Hi, my name is Georgia from BN Australia, and today we're going to talk about what you can do if the lightest pelvic floor weight isn't staying inside the vaginal canal. So maybe your pelvic floor isn't quite ready to retain the pelvic floor weight in standing or even in a sitting position. So this is where a beginner might start if they're trying to strengthen their pelvic floor with the weight. So a little bit of lube on the tip of the weight, and then we're inserting it into the vaginal canal. So the weight is already inside the body. Then what you're going to do is lie down on your back. So you could do this on the floor, yoga mat, or in your bed. And then we're really just thinking about feeling where the pelvic floor weight is. So can you feel it inside the entrance of the vagina? What we're going to do then is visualize drawing it up towards your belly button. So we're trying to suck the vaginal weight up towards the belly button. So what you're going to do is take a nice big inhale, nice big exhale, and as you exhale, think about closing the entrance of the vagina and the anus. And then as you inhale, think about letting it go. So we're drawing the entrance of the vagina, entrance of the anus up, inhaling, letting it go. And just feeling that sensation of tightening around the entrance of the vagina, entrance of the anus, and then letting it go. We're going to do 3 more. Squeeze and lift up. Relax and lengthen down. Squeeze and lift up. Relax and lengthen down. And again, feeling that sensation of closing, tightening, and lifting, and then relaxing and letting it go. So that might be where you start. Once you can feel that sensation, then we might progress to a hold. So then we're going to squeeze and lift around the entrance of the vagina and the anus and hold it for 3, 2, 1, and then relax, feel it, let go, and open and lengthen. Inhale again. Exhale, squeeze and lift. Keep breathing and hold for 3, 2, 1. Inhale, relax and lengthen. And again, you might do 10 to 15 reps of that before progressing on to the next stage. If you can tolerate that, then we might either move to a side lying position and then repeat the same 2 exercises. Or again, if you can tolerate it, you might then progress to being on 4-point kneeling or on your hands and knees. And then again, we're thinking about drawing that pelvic floor weight up and then relaxing it back down. If that feels tolerable and you can handle it, that's when we might progress to a slightly more gravity-fed position. So you're still not sitting or standing, but maybe you've got some pillows and you're rocking your hips back so that your hips are a little bit lower than your chest, or you might be propped up on the back of a seat, for example, or on some yoga bolsters. So we're a little bit more on this declined position now. And again, we're thinking about drawing the pelvic floor weight up and then relaxing it back down. Drawing it up towards belly button and relaxing it back down. Once you can tolerate that, the progression would then be to sit on a firm surface, potentially even with a rolled up towel in between your legs so that you've got a little bit more pressure on the perineum. So rolled up towel in between the legs, and then again we're practicing that lift and lower, lift and lower, and then that lift and hold and squeeze and tighten, and then relax and let it go. Once you can tolerate that, you then might move to standing, and you might just do a couple of reps in standing and then sit back down and gradually increase your load until you can tolerate being in an upright position without the weight completely falling out. For more information about our pelvic floor weights, or to learn more about who they're appropriate for and what they can be used for, you can head to bn.com.au.